Hello, Facebook. I want to welcome you to this very important discussion on mental health. This is an issue in our country right now with the pandemic and so many things that are stressing people out. We thought it's very important that we do a deep dive into mental health and how we can identify it and also treatment that is available. Joining me for this discussion is Dr. Patrick Runnels. He is the Program Director of Public and Community Psychiatry, also the Medical Director in Emergency Psychiatric Services at University Hospitals, Cleveland Medical Center. And Dr. Runnels, I thank you so much for helping us shed some more information on mental health in our country right now. So I appreciate you taking the time.
It's my pleasure, and thank you so much for having me.
So first of all, let's talk about mental health and where we are now. We are seeing an increase with the pandemic, and of course, different situation here. No more normal. What is normal? And so that has triggered some tough emotions for people.
Yeah, and Danita, I think that's what you might expect in a situation like this. So if we take a look just and think about what's going on, for the last 6 months, our routines have been massively upended. We've had a tremendous amount of uncertainty injected into our lives. For some people, that uncertainty is about their economic well-being. For some people, that uncertainty is about what they're doing with their schedule for the day. For some people, that uncertainty is about who they'll even interact with. And so you add to that and all those very intense stressors, the uncertainty of whether or not you might get sick, and the uncertainty we've had with all the different messaging around what's the way to not get sick and what does getting sick mean and how do you protect yourself and others. Those messages changing, all of that increases stress. All of those things increase stress. And as stress increases, we know that both anxiety and depression increase a whole lot. So given everything that's going on, it's not at all surprising.
And I want to invite all of you who are watching Facebook Live right now, if you have questions or comments for Dr. Runnels, please feel free to write your questions, give your comments. We'll make sure that he tries to get to as much of it as possible. But you and I were talking yesterday, Dr. Runnels, on my podcast, Voices for Change, and I called it Pressing Through Depression because it is a press and it's very difficult. Can you just break down exactly what depression is, if you could define that, and some things that we should be on the lookout for, some red flags, so to speak?
So depression is more than just a feeling of depression. So the core of having a depressive disorder is an overwhelming sense of depression or sadness that lasts longer than 2 weeks, that is pervasive across your whole life and includes another of other signs and symptoms that come with it. Those signs and symptoms include a loss of interest or enjoyment of activities, decreases in pleasure, potentially guilt about how you're doing or what you've done in the past, difficulties feeling like you're moving slow or like you just don't have a lot to get up and go, feelings as if your concentration and your focus are not going well. And then when depression is more severe, people often have thoughts and feelings of wanting to hurt or kill themselves. And so all of those things in some combination together represent what we call a major depressive disorder.
And the CDC just released a survey yesterday talking about the latter thing you just said about the suicide, that in that survey of adults, that 11% of the people admitted that they have considered taking their lives. And this is just within the last week of June. So this is fairly recent, that times are really pressuring people to feel like life is not worth living.
Yeah. And again, when you think about the tremendous stress that people are under and that tremendous isolation, something I didn't mention before, take all of this and then take all of the social support that we normally have. People, are all, your parents or your children, those, the people that are closest to you are often people that you not only aren't going and seeing, but you maybe are purposely trying to avoid to keep them from getting sick. You take those supports away. You create a lot of uncertainty in their lives, specifically for those whose economic status has changed and their income has changed and they've lost their jobs. They're isolated. All of those things are things that we fully expect would go up in a situation like this. When you hear experts talking about the trade-off and the balance, we want to save lives from the pandemic and COVID, and also the consequences of what will happen when we do that. That's really what we're struggling against, and that's what makes this so hard.
Dr. Runnels, let's look at some of the groups of people that really have been experiencing a lot of depression and anxiety. In the CDC study, one group had a high number, and that was adult caregivers.
Mm. So I think this is a really, really important thing that existed before COVID. So there are a lot of scenarios in our lives that, create special burdens. And our society, especially with healthcare in some ways getting better and allowing people to live longer, also sees us with more people who have, especially as they get older, care needs, right? That are less and less able to take care of themselves or more likely to need that support. And the reality is insurance only covers so much of that. So a lot of that burden for just kind of getting through what we call activities of daily living falls to loved ones. The burden of caring for people, and let's be very clear, for a lot of people, these are the people we love. So it's something we all, so many of us feel like we have to do. But that burden of caring for people can be one that adds just another layer on top of all the other stresses. Add to that you're usually caring for someone whose function's declining, whether or not that's their mind and brain or their body. And so you're not only having to do the caring, but you're having to watch usually a very close loved one slowly, not be the person they used to be.
Dr. Runnels, I did a podcast a few weeks ago. It was an article on CNN.com, and it was titled Generation X Women Were Already Exhausted, and then the pandemic. We know that depression and women, they seem to have a very close relationship for many, many reasons.
Yeah, so we've got, there's a couple of things going on there. The Gen Xers right now are starting to move into the category of people who are caring for their adult parents, so the boomers. And so that cohort now is needing, so Gen Xers and women carry the far disproportionate burden of this, are the ones doing a lot of the caregiving for their parents. They're also, we've had so much in the press about how women are disproportionately caring for the needs of their house and their children. And so that squeeze that generation's feeling between caring for the older generation and the younger generation is a big piece of this, right? That's a burden that's increased a lot over the last few generations, especially on the upper end. And then what we expect of parents nowadays, especially with the proliferation of women in the workforce, has increased as well. So women are working and they're expected to be even more active parents and more engaged parents than they were a generation ago. And now their parents are getting sick and need their help. And of course, this is falling disproportionately and, in many ways unfairly onto the shoulders of women.
And we have a woman that just said that she was a caregiver for her grandmother, and it was extremely hard. She is a mother of two boys, and it was very tough on her. But she said it was love that got her through it. The love of your relative.
Having that social support cannot be underestimated. We talk about risk factors for people sinking into depressions, and among the strongest risk factors is social isolation, and among the strongest protective factors is a really close network of support. And often that close network of support, when it's really tight, helps people carry that burden. And those things matter just so much.
So let's look at the African American community and the Latino community, communities of color, and how it relates to mental health. We knew even before the pandemic that there was a crisis there. Tell us a few of the factors that play into that in communities of color and mental health, some of the barriers even today that still exist with them getting the help that they need.
So to start, let's be very clear. The history of the field of mental health is one that is full of both stigma against people with mental illness, and that's across all cultures and all demographics. But the history of mental health treatment in this country is one that had frank structural racism built into how it approached particularly Black Americans and their experience in this country. And so when you have that history compounded, and there are a number of historical examples in the field of healthcare, but particularly in the field of mental health care, that broke trust with with the community, and it didn't feel like it was something that was going to help. It felt like it was something that was impeding or hurting. And so you take that, and then you take a culture that generally has its own stigma, about mental health, and then you add to that our field is disproportionately, compared with the general population, really not representing a number of underrepresented minorities, particularly Black Americans. I forget the number. I believe it's 3 or 4% of mental health professionals are Black, while that's 17% of the population or so, right? So we know from a lot of studies that people are much more likely to feel good about and follow the recommendations and report wanting to continue to engage with someone that they see as culturally sympathetic or similar to them. And so depending on your background, you're much more likely to seek help. If no one looks like you, then it feels something like you maybe don't trust quite as much. Lots of barriers there, things we as a field really, really need to work on.
Yeah, and one thing in our podcast with the two women that were so courageous in sharing their stories of managing their depression. One woman used medication and it worked for her. The other woman said medication did not work well for her, and so she had to take a holistic approach. Can you elaborate a little bit about the treatments and why medication works for some and may not work for others?
So the very good news about depression is there are a lot of treatments that work really, really well for depression. And the second piece of good news is there's a lot of different types of interventions that we have. The one people think about the most usually is medication, and medications can be great tools for lots and lots of people, and there's a great evidence base that they help. At the same time, I think one of the guests we talked to yesterday who was sharing her story talked about having a really bad response to medications, and it wasn't a good choice for her. And we very much respect that. And again, the great news is there are all kinds of other choices that can do very well as well. So along with medications, we have all kinds of types of counseling, and which can be a very, very, not just great for the treatment of depression, but great for processing a whole range of feelings. We have, things, I think one of the women talked about having like a sunlight, which in Cleveland with all the cloud cover, that can be a big.
Goes down here in Cleveland, Dr. Runnels. We don't get a lot of sunshine in the winter.
Yeah. Yeah, no, actually, you can't see right now. I actually bought a sunlight for my home office here. No, that actually has a lot of evidence that it works. And people try all kinds of things, and one of the things we suggest is there are just things you can do in your life that really mitigate a lot of the symptoms, including kind of purposely, exercising and purposely getting out and getting more social interaction, finding ways to change your routine in your day so that you're actually creating really good separation between things that are more stressful and things that are less stressful. A really common one is just being mindful and taking time to clear your mind and be in the moment, and that's a skill that we can all practice. And that can help a whole lot.
And I think another thing that came out of our discussion, and I think women, we are definitely more guilty of this than men. Both of the women stated in the podcast that they had to be mindful to make themselves a priority. And a lot of times women, we have so much we're juggling, and most of those balls don't have our names on it. And so if you could talk about the importance of, especially with women, that we must be mindful to take care of not just our physical bodies, but our mental health as well.
Yeah, so this concept of the sacrifice syndrome, which is exactly what you're talking about, there's a lot of cultural pressure for women to be the caregivers and to take on all these roles and to then not burden other people with their feelings and emotions, which they then keep inside. And, if you're busy caring for everyone else, who's caring for you? And so in order to not burden other people keep those feelings inside. And that creates kind of a stew in there to kind of really push you into either a very anxiety provoking place or into feeling depressed and overwhelmed. It's really, really important. And you're very right. They had to be mindful, and this is important, to create that space to care for themselves. Sometimes you don't have the choice. Sometimes there's a lot of caring you have to do, and there aren't a lot of choices. I know there are a lot of, single mothers out there, for instance, is a perfect example of, that you're often doing so much of that on your own, but finding space to take care of yourself is really, really important, and can go a long way towards helping you not feel overburdened overall.
Dr. Runnels, the person who may be on this Facebook Live right now, they're afraid to type in a comment. They're afraid to type a question. They don't even want anyone to know that things that we're talking about, they have been experiencing. How would you encourage someone to talk to someone, at least one person, because we know that that's important? Silence can actually be deadly in this case.
So a couple things that I would say to that. The first is it's really important for people to hear that mental illness is really, really common. There's a statistic that says depression is the second most common cause of disability behind just heart disease. The next most common cause of disability is depression, just one mental health diagnosis. But mental health issues are really, really common. The statistic I quote to people is around 25% of the population will at some point in their life experience a diagnosable mental health disorder. That means that 1/4 of the people in our country are going to experience this at some point. And so the first really important thing to kind of point out is you're not alone. This is really, really common. It doesn't make feeling bad normal, but it's really important to recognize that this is a shared experience that many people have, and everyone has multiple loved ones in their life that has suffered from a mental health illness of some kind or another. In terms of how do you reach out and seek help when you're not sure how other people respond, and the best answer is if you're a little nervous, to talk to someone one-on-one and start there. And you don't have to use words like you don't have to start with the biggest bomb. Just start with saying what you would normally say to people is, "I'm just not feeling well." Or things aren't going well, and just get a chance to get it all out. And usually once people start to hear that most people do respond quite well. That said, if you're very nervous about how people in your life are going to respond, things I just really want to emphasize to people is we have a mobile crisis line in this county. I believe the number is 216-623-6888, although people can check that for me. And if you want to call someone anonymous, they're available 24/7. You can pick up the phone and say, "I'm not feeling good," in whatever way it is. It's run by Frontline Service. It's a wonderful organization that does wonderful work, and those people will listen to you. You can always call your primary care provider. Primary care providers are people that hear this kind of thing all the time. They're trained to explore this and get you to the right person and get you the right help, or just help you think about how to get the right help in your own life and get the right connections. So all of those are ways that people should think about how they might start by broaching this topic with the right person.
I think something that helps the conversation around mental health is the fact that we have many celebrities who have come out and really confessed their own mental health issues, their mental health struggles.
Mhm.
Cleveland Cavalier Kevin Love, and just recently,
Mhm.
former First Lady Michelle Obama. How does that impact the response to people wanting to get the help, maybe opening up a little more if they see a star has
Yeah.
it too? So maybe it makes them feel, okay, if they have it, then I can maybe have the courage to say I'm having some issues as well.
So we actually have a lot of evidence that 30 or so years ago, mental health stigma against mental illness was really high, and the field of lots of different professions, psychologists, psychiatrists, and others, spent a lot of time thinking about what we could do to reduce that stigma. And there was a really concerted effort starting about 20 years ago to get campaigns for helping reduce stigma by way of helping people kind of share their own experiences. Those campaigns actually increasingly focused on people of note, public figures, and there's an evidence base to show they've had a really big impact on helping normalize the experience of having mental health symptoms. Kevin Love was so courageous coming out and talking about he had anxiety. I think, in fact, panic disorder is what I believe he talked about. And so he talked about his anxiety disorder very eloquently, and particularly athletes who are held up as being, invincible in a certain way, as being these really strong figures, to get up and just kind of talk about, if someone who's won an NBA championship ring, to talk about how anxiety really impacts them. And then Michelle Obama, I believe, who is ranked the most admired woman in the country, is to get out and say, hey, look, I'm having a tough time. Here's what it's like. And it's an experience I'm going through. When people see those, and they see diverse faces, and they see people they relate to, and they see people who they admire, it becomes much, much easier for everyone to kind of break through that stigma and start to feel okay about opening up. The impact cannot be underestimated.
Okay, we have a question. Dr. Runnels, have you heard of tapping? I think that's what she's saying. Have you heard of tapping? Do you suggest?
I have to be honest, I've not heard of tapping. I assume, and I don't know if the questioner can talk a little bit more. I assume that means actually tapping is the best guess I can say is that there are, as a kind of therapeutic tool, anytime you can do an activity that takes your mind out of whatever thoughts are in there, that can be therapeutic. That's, again, a process called mindfulness. So I do a lot of exercises with people that are designed to clear their mind and make them focus on the present. Tapping's one where if you're, I can see where if you're tapping and you're focused on the tapping and what it feels like and doing it, that your mind clears a little bit. That can be a very relaxing thing. But I don't know that there's any evidence for tapping as a therapeutic intervention itself. But that larger idea of mindfulness is really important.
So we have another comment. My husband is depressed, does not have any friends. I'm in a wheelchair. He won't go to a doctor. He looks to me to make him happy. What should I do?
So this sounds, for people in this situation, what I'd say is this is really common. And this is, it's not an uncommon scenario that a wife identifies a husband or another male in her life who's both expressing or just exhibiting signs that are really clearly depression or anxiety, and also saying that they really, really don't want to go get help. And so, the first thing, we always recommend to people is have a conversation that starts with, what are you willing to do? Something I have to tell people a whole lot is, almost no time do people take advice they're not ready to hear. So if when you kind of say to someone, you must go do this, people kind of resist. They naturally kind of say no. But if you take a different approach, is to say, look, I'm unhappy. I know you're unhappy. What are some things we could do differently? And get them to start to surface some of the ideas that they have about what they might do, what they might be willing to do, and where they might be willing to start, and put it in phrases that are about you as opposed to them, so that it becomes about them helping you as opposed to them kind of dealing with this thing they're seeing as a flaw or as something that's a weakness. That can be maybe a good start, but it's a really common problem, and you're not alone when you face that kind of resistance.
Loretta, I hope that helped you. Sybil has a question. Can you describe panic fatigue?
So I haven't heard the phrase panic fatigue, but panic disorder is a disorder in which you have panic attacks on a recurrent basis. And the panic attacks typically last 10 to 30 minutes, and they're defined by paralyzing fear, chest pain, shortness of breath, tingling, feelings like you're going to die, and you're really kind of almost paralyzed for a small amount of time that then go away. And they're characterized by coming out of nowhere. That's panic disorder. You have those enough and you absolutely get completely fatigued. And so that may be what you're getting at. But people who have a common recurrent panic disorder end up becoming very exhausted all the time by the experience of being so scared you think you're going to die. And in that sense, fatigue is a really, really common kind of side effect of that syndrome.
In your practice, Dr. Runnels, have you seen things that you wish could be better when it comes to your field and mental health? And where are the improvements that you see personally, what needs to be done?
So while mental health and behavioral health interventions have come a long way, we don't have perfect answers for lots and lots of illnesses. There's illnesses we don't have great treatments for. There's treatments, there's actually an audience member that asked a question about whether or not this drug and that drug interact. So for a lot of people, one medication helps the depression and it's great. But for lots of people, they end up getting on multiple medications and sometimes those medications interact and sometimes they only help a little bit. But so there's always a need for research into better treatments. But I'd actually say our biggest flaw has been access. So for me, traditional access to mental health requires you to make an appointment and go in to a group of people there's not enough of us. So there's actually nationally about a 40,000 psychiatrist shortage. That's just for the psychiatry part of things, which is the medication prescribing and diagnosing part. There's far fewer of us than there ought to be. And so getting into seeing us is really, really hard. And then we often push appointments out for follow-ups very late. So an area that I think the number one area we need to work on is making it much, much easier to get in, helping leverage a wider range of professionals to help make sure people get that work. Looking at things like technology so that rather taking a whole day off to come see me in the office, you can see me like we're talking right now through video, just over a lunch break, making it so that there are different ways to access care. That's where we really need to do that work.
I haven't seen any questions on this yet, but I have to ask you the impact on children and their mental health right now with learning, quarantining, not being able, to do the things they are normally able to do, the impact on children, and how can parents manage the emotions and feelings that are coming as a result of this?
So the first thing I'd say, there's not easy answers here. If school's all virtual and you're forced to both be at work and manage your kids at home, and that's not what you're good at, and that's not what you're used to doing, and you're balancing all this, very, very, very tough. That said, there's a lot you could, the first thing that we say to parents is helping make sure the kids have a diversity of things they're doing throughout the day, even if it's just a little bit of diversity, is really important. Modeling the behavior you want them to do is really, really, so if you want them to wear masks, you're wearing a mask, they're much more likely to do so. When kids see their parents doing things, they tend to be more likely to do them. And then the last thing is, don't kill yourself into thinking you have to make this experience perfect. This is going to be temporary. And your kids don't have to be ready for Harvard tomorrow. They don't you don't have to put pressure on yourself to be an amazing teacher. Kids are resilient. Kids do well. And what's important is that everyone's taking care of themselves and in a loving environment. And if you can do that, we'll get through this. That's the most important thing.
Yeah, I'm glad you brought up the mask, because kids wearing a mask all day, wouldn't that present, if they're not used to seeing it, let's say their parents aren't wearing masks, but they go to school and they're forced to wear their mask all day, wouldn't that present some type of anxiety?
So let's be very clear. Masks are a little anxiety provoking for any number of people, kid or adult, and kids are more impulsive than adults and more likely to pull at them and more likely to pull them off. By no means would I suggest that it's going to be perfect. But that said, kids do pretty well when you create nice structure around. And if there's nice structure and clear expectations, a lot of kids can do pretty well. you're right. They're not going to do perfect. And part of the calculation schools have to make as they reopen is really figuring out what the likelihood of the average kid is going to be. But they are more resilient and more capable of doing things when you create the right structure than people give them credit for.
And they can have their creative mask and have fun characters.
Oh, yeah. They put a superhero on it and all of a sudden it's great.
Makes it easier. Well, Dr. Patrick Runnels, we thank you so much for giving your time to this very important issue. I've enjoyed talking to you. If you want to hear more in this discussion, check out my podcast. It's on our website, Spotify, also Apple iTunes, but definitely an issue that we cannot ignore. Mental health crisis, I believe, that's in our country right now, and all the things that you can do to help yourself and even to inform others, because information is power, and that always helps. So thank you, Dr. Runnels. And
thank you very much, Danita. Really appreciate it.
Yes, and thank you for all your questions and comments today on our Facebook Live. And hope we gave you some information, and we gave you lots of hotlines as well, that if you need help, there is someone available to speak with you. Until next time, have a great day, everyone.